Guatemala is a country located in Central America. It is considered to be a third world country where it has high rates of violence, gang activity, high levels of poverty, and low literacy rates. It has an estimated population size of 17.2 million people. Guatemala came under democratic rule in 1985 and ever since has had slow economic and political growth. The religion in Guatemala is Roman Catholicism, but much of the culture is influenced by indigenous Mayan beliefs.
Guatemalans will utilize traditional Mayan medicine, in which they believe they cannot separate the spiritual world from the physical world. So diseases and illnesses are affected by both situations. Because of this, Mayan healers will often spend an hour or more with each patient, much different than in the United States, where it is rare if you see the doctor for more than 15 minutes. The long appointments allow time to consider the spiritual, interpersonal, and societal factors that could be causing the health problems. Many indigenous communities have rigid cultural practices, and they feel that national health systems do not respect their traditions. Therefore, many prefer a traditional healer who uses a more holistic approach to medicine. The World Health Organization, or WHO, has developed a traditional medicine strategy to increase awareness and understanding of these holistic practices, so that they can be recognized as valid cultural and medical responses to health problems around the world. Unfortunately, in Guatemala, approximately 40% of the population is indigenous and speaks indigenous languages, while most healthcare providers in Guatemala will speak Spanish. This will cause a language and communication barrier regarding to administering health services. Guatemalan's constitution also states that healthcare is a universal right to every citizen. However, limited government resources and a lack of access to healthcare has made this cultural idea hard to guarantee.
Healthcare in Guatemala is set up as a universal, free healthcare system. The majority of healthcare is provided by the government through the Ministry of Health and Social Security. Funding for these programs is provided through taxes. The private sector provides a much smaller portion of the healthcare services within the country. Healthcare services funded and provided through private entities, such as nonprofit and for-profit organizations, are done so in privately owned healthcare clinics and offices, whereas the healthcare services provided through the Ministry of Health and Social Security, as well as other government-run programs, are done so in public hospitals and clinics. In Guatemala, disparities in healthcare funding can be seen in the ways that their own government spends a much smaller amount of money per citizen on healthcare as compared to their neighboring Central American countries. Disparities in access to healthcare professionals is a growing issue in Guatemala. Rural areas do not have access to the kind of healthcare resources and the number of resources as urban areas. Hospitals are primarily located in larger cities. Therefore, the disproportionate appropriation of healthcare funds leaves many citizens vulnerable. Advancements to expand access to healthcare facilities to rural areas has been a large focus of policy change in recent years. The map on the right displays where hospitals are located throughout the country, as indicated by the purple plus signs, and the distance from which many citizens live from a healthcare facility.
In Guatemala, physicians attend a 7-year program. They first earn a bachelor's in science over the course of 3 years, and then obtain their medical degree in another 4. On average, physicians earn $35,415 a year, and nurses earn $14,495 per year.
Despite significant improvements in the health of the general Guatemalan population over the past several decades, the health status of poor and indigenous Guatemalans, who comprise close to half of the total population, continues to be among the worst in the Western Hemisphere. Medicine focuses on treatment of diseases, not prevention, so there's a large amount of public health resources that are spent on procedures. The infant mortality rate is one of the highest in the region. Between indigenous and non-indigenous people, it is 3.4% or 34 deaths per 1,000 births on average. The maternal mortality rate is around twice as high in indigenous people than it is in non-indigenous people, and the malnutrition rate is 48.5% on average. We will be interviewing Olivia and Emily, 2 of our group members who went on a medical mission trip to Guatemala. So the first question that I have for Emily is, what are some major problems Guatemalans face regarding their health?
During my trip to Guatemala, I noticed many problems that individuals face regarding their health. Every day during my trip, we would travel from the city to remote villages. Most of the people lived in huts without running water or electricity. One large problem is related to smoke inhalation. The women of Guatemala cook over open fires inside their huts, and there is no ventilation system. As a result, many women die from respiratory distress. Another large issue is clean drinking water. Most homes, unless located in the city, do not have running water. Therefore, people often have to walk long distances to get pots of water. The water that they are collecting is often contaminated by animals or trash.
The next question that I have is, did you notice any disparities in Guatemalan healthcare during your trip?
Yes, so while in Guatemala, we spent most of our time working in a small rural village. However, spending time in these rural areas, it was very clear that the sanitation practices, access to healthcare, facilities, and services were pretty scarce. The multiple days we spent there, I don't remember seeing a pharmacy or clinic once. However, on our last day, we visited a popular tourist spot in the city. And while we were there, we had the chance to walk around the streets a little bit. And I remember seeing a pharmacy, more than one pharmacy on the same street. And so that was just one way I remember seeing the disparities in healthcare in the country between the rural and urban areas.
Question is, what can you tell us about access to healthcare in Guatemala?
So yeah, while in Guatemala, there were multiple things I noticed that definitely posed a challenge to access to healthcare for a lot of citizens in the country. But one very noticeable one was the mountainous terrain. Anytime we traveled anywhere from city to city or within the city we were staying in, all of the roads were very steep and would wind up and down the side of mountains. So additionally, healthcare services seem to be primarily located in the urban areas, and even within urban areas, it was difficult to get around due to the mountainous terrain.